All right, welcome back. While the current public health risk for the H5 bird flu remains low, multiple strains of the virus are still running uncontrolled through cattle herds and poultry flocks across the country. Here's what a duck farmer from Long Island says happened to his entire flock.
Corwin believes for his duck farm, a vaccine is the only way out of this crisis.
So is the government's billion-dollar strategy enough?
No. I know what our biosecurity is here, and I'm not saying it's perfect, but it's pretty darn good. This virus is so in the wildlife. It's so endemic. Without some type of viral protection, we're not going to get rid of this.
Now, a new piece for New York Magazine's Intelligencer takes a look at what a response may look like if the bird flu virus mutates to infect humans, and if the correct measures are in place in case another pandemic takes hold of the country. Joining us now, the author of that piece, Christopher Cox. He is a features editor at New York Magazine. Also with us, NBC News medical contributor Dr. Vin Gupta. Christopher, I'll start with you with the piece here. What is happening right now, the state of the bird flu with flocks and herds across the country, and the chances of this transferring to humans? Probably not using the right terminology, but
no, that's right. Yeah, and the virus is everywhere. One expert I spoke to said it was the country is a swirling pot of virus with every species thrown in the middle. So it's in wild birds, it's in poultry that we're raising on farms, and it's in cows. That's the big change from a year ago. It jumped from birds, where it's been for decades, to cows for the first time. And those cows are in turn giving it over to the people who work on those farms. So it's jumping into people at a rate we've never really seen before. And so the question is, how long can that happen before you start having human-to-human transmission?
So what do we do? How do we stop it?
How do we stop it? Well, I mean, it's mainly animals right now.
Right.
The virus is not good at infecting people, and we're lucky. But that's not going to be true forever.
Wait, but you say it has infected people.
It can infect people, but it's not sort of very good at it. So it can get in your eye. And strangely enough, there's a little receptor in your eye that is the same receptor as on a cow's udder. And so by that coincidence, it can infect your eye, can infect a cow, but it can't really infect your lungs very easily.
Right.
And so until that changes, we're safe, or safe enough. There'll be some jumps to farm workers, but not you and me. I'm not going to cough on you and give you bird flu. But the longer you let it sit in the cow population and just
it's coming.
Yeah, it could mutate, and when that mutation happens, then it starts going person to person, and that's a pandemic as soon as it spreads rapidly like that.
And you know, Will, we have a friend that you and I know, won't mention her name on the air, but had bird flu like 10, 15 years ago and almost died. I mean, when it does jump to humans, it can be deadly fast.
Yeah, it can be really deadly serious. Dr. Gupta, just to keep this in perspective a little bit, there are 340 million people in the United States. CDC says there are 70 cases in humans. What are the risks, though, as you watch this? We hear about bird flu a lot. There are concerns that if it did make the jump to human beings on a wide scale, obviously it would be a pandemic, potentially. What are your concerns as you see these headlines right now?
Well, you know, Willie, about a year ago, the CDC recommended that anybody that came in to a hospital and had confirmed flu should then go for additional testing to say, is this actually bird flu? That was a recommendation. It wasn't broadly followed because it requires resources and things that are frankly hard to do sometimes. And so to answer your question directly, we don't know the full extent of how much bird flu is actually spread amongst humans. To what degree has it been asymptomatic spread or, say, mild spread so that people don't even seek care, much less get tested, including those that end up in the hospital. So I think we're underestimating spread. Two, outside of, say, California, that has a state of emergency when it comes to everything that Chris is saying, to testing dairy farms, to making sure that we have rigorous protocols in place to minimize even spread amongst animals. California is the leader there. Outside of that, we have 49 other approaches here, which don't approach what California is doing. And as a result, this is running amok in animal populations. I'll say here in Washington State, 20 big cats died. And so when we think about cows first getting impacted by this, now we're seeing big cats getting impacted and dying. I mean, it is pretty cataclysmic what's happening amongst other mammalian species.
So, Chris, let's talk about what would happen if it does take the leap to humans and we are facing another pandemic. And I suppose this could apply to a different virus as well. Just assess, I know this is part of your piece as well, assess the readiness of this nation to handle another pandemic, so soon after COVID, which became such a political response. And I know there's been some concerns that we're not nearly as ready this time around.
Yes, that's right. In fact, one of the experts I spoke to said that he thinks it's not going to be bird flu, it's going to be another coronavirus. But whatever it is that comes down the line, we have to be prepared for it. And in many ways, we are less prepared than we were after COVID. We learned lots during COVID, but whether it's the willingness of people to do social distancing, do the things that we might have to implement to respond to the virus in the first place, but most importantly, this country is not ready for a new vaccine to be embraced by the whole population, but that's what you need if you have a novel virus circulating.
Dr. Gupta, last time you and I spoke, it was actually not about bird flu. It was about the measles outbreak, and that was a couple of weeks ago. Can you give us an update on where we stand there? The headlines are that there are over 300 cases in New Mexico and Texas. What are you hearing about the speed of the spread and how lethal this could potentially be, particularly for children?
Well, Katty, I think it's the same concern here is that what we're seeing is some people are not even presenting to care in New Mexico and Texas until they're very, very sick. So one, the question here is, are we underestimating spread? Similar sort of idea with bird flu, are we underestimating spread? Because people aren't presenting to care. So that's one. And two, I think we're now seeing the family, sadly, that lost their child to measles. We're seeing now a better understanding of how they were thinking about it. They gave an interview recently, and there is this concept, sadly, this motif here that amongst those that are not getting vaccinated, they somehow think that, and this is from our current health secretary and his former organization, the Child Health Defense, that somehow the vaccine is causing this outbreak. So there's misconceptions that are deep. We're talking about treatments. We're seeing people pursuing treatments, Katty, like vitamin A and others that are not treatments, that are purely misconceptions and misinformation. So this is spreading. I think we don't understand the magnitude of spread, and clearly what's happening with the HHS secretary spreading this information, being a leading protagonist here, is having impacts.
All right, we'll be following this for sure. NBC News medical contributor Dr. Vin Gupta, thank you. And features editor at New York Magazine, Christopher Cox, thank you as well very much.
Guys.